This is the In Focus podcast from The Hindu.
Hello and welcome to another episode of the Hindus in Focus podcast. I'm Zubaida Hamid, your host for today. Another public health emergency has hit the world, and this time it's Mpox, previously known as monkeypox. The outbreak is sweeping through West, Central, and East African countries, and in the past few days, cases have also been reported closer at home in Pakistan and in Thailand. While Mpox has been around for decades, this time around, a deadlier and far more transmissible strain known as Clade 1b has driven the recent surge in cases. This strain is believed to cause death in about 3.6% of cases, with children being the most vulnerable, according to the World Health Organization. The Indian government has said that there is no call for alarm as of now, but has also said that hospitals have been alerted and large scale testing is being looked into if the need arises. So, what is Mpox? How is it caused? How does it spread? What are the signs and symptoms? What are the treatment options available? And is there a vaccine? Importantly, how concerned should India be about this latest zoonotic viral disease? To delve into these questions, we have with us today Dr. V. Ramasubramanian, Consultant Infectious Diseases Specialist at Apollo Hospital in Chennai and Medical Director of the Capstone Multi-Specialty Clinic, also in Chennai. Hello and welcome to the Hindus in Focus podcast, Dr. Ramasubramanian.
Hi, happy to be here.
Doctor, could you explain to us what Mpox is?
Mpox is the new name given to the virus which was earlier known as monkeypox. So this monkeypox virus was first identified in 1958 in Denmark when they found this as an outbreak in a group of non-human primates. To put it very simply, it is monkeys which had been taken from Africa for animal experimentation. And this was identified as a virus which was very, very similar to smallpox, belonging to the same group of viruses. And this caused predominantly infections in animals, what we refer to as zoonotic disease, or that which is found only in animals. Subsequently, they have identified a human case later, much later in 1970, in the Central African country known as the Democratic Republic of Congo. Now, this was in a very young child, a 9-month-old child, which presented with fever and skin rash, which looked like smallpox, small vesicular or bubbles-like lesion appearing on the skin. This time, the virus was cultured from one of these skin rashes. And since then, it has been endemic. When I say endemic, it has been seen periodically on and off in several countries of Africa, predominantly in the Democratic Republic of Congo, in the Republic of Congo, in Cameroon, in Ivory Coast, Nigeria. So several countries, this has been going on since 1970. There have been periodic outbreaks in other countries outside Africa. In the US, it happened. In Singapore, it happened. A lot of them were because of animals which had been brought out of Central Africa to these countries for various reasons. And from the animals, it spread to humans also. But the major one which happened was in 2022, when it affected several European countries, UK, and also the United States.
So then this is the second major outbreak, correct, following the 2022 outbreak?
Outside of Africa, yes. Though there have been several outbreaks. If I look at the major ones, there was one, I think, in 2003 in the United States, 2017 in Singapore. And after that, the 2022 one, which was a global outbreak. And now we are finding one which is similarly brewing up.
You talked about the fact that it belongs to the same family as smallpox, doctor. Could you explain to us a little bit about that? What are these clades 1 and 2 of Mpox that people are talking about? And why is clade 1b of particular concern right now?
Okay. Now, as I said, they belong to the same group, which comes under the genus of orthopox virus. And they belong to a higher category called as vaccinia viruses. So these viruses, again, are predominantly of animal origin, which can subsequently happen in humans also. So if you look at the transmission of the virus, it is animal to animal, animal to human, and then human to human. So this is how it has been behaving. And if you trace the origins as to the number of varieties of monkeypox or the Mpox virus, it has been shown that they belong to two major types, or what we refer to as clades. So there is a clade 1 and a clade 2. Clade 1 and 2 are subsequently divided as clade 1A and 1B, and 2A and 2B. So the Central African clade, which I was referring to earlier for all these years, has been predominantly in the Central African countries of maybe even South Sudan, Democratic Republic of Congo. And this type of virus is clade 1 virus, which is generally a little more nasty than the clade 2. Clade 2 viruses are seen in West African countries. So you can divide the origin of the virus either from Central Africa, which is clade 1, or West Africa, which is clade 2. Clade 2 is a little milder. It causes less severe infections, and the mortality rate or the death associated with this infection is also much lower with clade 2. And there have been a lot of outbreaks of both clade 1 and clade 2 in the African countries. But the virus which spread out of Africa, causing the major involvement in European and countries and America in 2022, belonged to clade 2.
You said that clade 1 was the more virulent and nastier version of the virus.
Yes, and the current episode which we have identified right now, which started in the Democratic Republic of Congo and now spread to cases in Sweden, Pakistan, and Thailand, belong to clade 1B. Now, clade 1B is believed to be more agile in getting transmitted between humans, and also is associated with a higher death rate. If you look at clade 2, the death rates have been anywhere from 0.5 to 3% on an average, whereas this clade 1B, which we are finding now, can be associated with death rates as high as 10%. So somewhere in the region of 5 to 10% is believed to be the death rate due to clade 1. So that is the reason there is a lot of concern when clade 1B is now being seen outside Africa. There is a lot of concern, especially in people whose immune system may be damaged. We are typically looking at young children, pregnant women, people with immunosuppression, maybe HIV or other immunosuppressed conditions where the mortality may be high.
Thank you, doctor. That was very clear. So tell us a little bit about the transmission of the virus itself. You told us it's first animal to animal, animal to human, and then human to human. How exactly does it get transmitted from animal to human and then human to human?
Yeah. So if an animal has monkeypox infection, and a lot of times this is asymptomatic infection, we still don't know what is the animal reservoir. The main animal species which carries this virus is still not known. But the typical animals include several types of prairie dogs, several types of squirrels or rats, which may come into contact with humans. Either they may scratch the human, they may bite the human, the secretions of the animals may come into contact with the human, or even consuming bush meat may transmit the virus from an animal to a human. So it's predominantly animal fluids, animal body fluids and secretions which can transmit the virus. Once it has reached the human, it is believed that the infected person's body fluids carry the virus. So this can be transmitted through large droplets like COVID, like SARS-CoV did. It could be transmitted through large droplets of the body's secretions, which is mainly the respiratory secretions. The bubbles or the vesicles which are found, the skin rash on the person, may also have high concentrations of the virus. So close contact with the person, a family contact, it could be sexual contact, any of the conditions where there is a close contact with an infected person directly or through large droplets may transmit the virus to other members.
You said close contact, especially sexual contact, family contact. Anybody who is in touch with an infected person basically could get infected themselves, correct?
Yes.
What are the signs and symptoms once you are infected?
The incubation period, or the time taken after exposure to the development of symptoms, is somewhere in the region of 5 to 14 days, can be as short as 3 days and as long as 21 days. On an average, we are looking at 1 to 2 weeks is the time when person starts manifesting symptoms. The symptoms start as a prodrome, which, like any viral infection, the person complains of a feverish feeling, body pains, headache, back pains, eye pain. This happens in the first 3-4 days. Subsequently, the patient develops a rash. The rash starts off as a flat rash and then may turn into a bullous or a vesicular or a bubble-like rash, which is typically distributed in the upper limbs, lower limbs, in your body, around the genital areas, especially if it has been sexually transmitted, it is around the anus and the genital areas. The rash can resemble chicken pox, but the difference between chicken pox and this, which both of which may be associated with fever, body pain, and rash, is that in chicken pox you don't get swelling of lymph nodes, whereas in monkeypox, typically number of lymph nodes in the body swell up. Second, in chickenpox, we rarely see rash on the hands and feet. It's mainly on the body, in the mouth, in the eyes, sometimes on the scalp. But in monkeypox, the rash is quite often seen on the hands and the feet. And also in chickenpox, the rash is seen in various forms. Some of them are flat, some of them are large bubbles, some of them small bubbles. Whereas in monkeypox, all the rash are similar. In other words, the evolution of the rash is very, very same in all parts of the body with monkeypox. So when a person starts with a viral illness of fever, body ache, headache, tiredness, all that, subsequently develops lymph node swelling and then a rash, which can be distributed, as I said. We need to think of monkeypox, especially if there is a epidemiological connect or travel to a place where this is seen, like in African countries, or exposure to a person who may have had this. That is when we think of monkeypox.
Talk to us a little bit about treatment options, doctor. Is it like many of the viral illnesses where there is no specific treatment for it?
Yes, this doesn't have a specific treatment. There are several drugs which have been used, but they are not typically licensed or manufactured for Mpox. For example, there is a drug called tecovirimat, which is an antiviral agent effective against the smallpox virus, which has been found to be of use. This is used typically in people who are immunocompromised or who have a severe disease or where it affects the brain or other complications happen. Because most of Mpox is self-limited. The rash lasts anywhere from 2 to 4 weeks and the patient slowly improves. So you don't need to treat routinely all patients who have Mpox. If they have a poor or a weakened immune system, if they have a very severe disease, then you consider treatment. Treatment, as I said, is with tecovirimat. There are a couple of other drugs which have been used for other viruses like CMV virus, the cytomegalovirus. One such agent is cidofovir, which is given as an injection once a week. The other is brincidofovir, which is available as an injection or a tablet. These two are also effective against Mpox. Another chemical which we can use is, or shall I say another material, or we can use is, it's called varicella immune globulin given as an intravenous infusion. Now this varicella immune globulin, vaccinia immune globulin, the vaccinia immune globulin is collected from the sera of people who have had smallpox before. So these sera, or the blood from people who've had smallpox before, contains a lot of antibodies which are harvested and then given as an injection to the person who has severe infection to help get rid of this Mpox symptoms. So these are the three agents which are usually used, not routinely, but in selective population, depending on the availability and the nature of the illness, to decide whether they will benefit from this.
Talk to us a little bit about the vaccine, doctor. We, as the world, eradicated smallpox, and you said that this belongs to the same family. So does that mean making a vaccine is already available? Is it already very effective, or we are not there yet?
Now, the smallpox vaccine, which was last probably given in 1980, has found to be quite effective against this virus, because I told you smallpox and Mpox belong to the same family. There is an 85% cross protection with a smallpox vaccine in preventing the occurrence of Mpox. So people who have been vaccinated before 1980, which includes me, have a very good chance of avoiding Mpox because my body still has antibodies which will help protect me. So this infection is typically seen in the younger population. People probably in the region, less than 40 or 45 are the ones who are likely to have problems with this. The elderly who have been vaccinated with smallpox are naturally protected. Apart from this, there are 2 or 3 vaccines which are currently available in certain parts. They are not available in India. We have a vaccine called the Jynneos, which is also available as Imvanex or Imnavune, which is available in certain European countries in the US, which are similar to the vaccine used for smallpox. It is a non-replicating vaccine, so which is safe, and it is believed to protect upwards of 80%, maybe even 90-95%. Another vaccine is called ACAM 1000, and this vaccine is a live vaccine, so you cannot give the vaccine for people whose immune system is deranged. But this can be tried, though this vaccine has a lot of side effects, including cardiac toxicity and also severe pain at the injection site and even fever. So this is another option. There is another vaccine called the LC vaccine, which is also available. But all these vaccines have now gotten emergency clearance. A couple of them have gotten emergency clearance for use in both pre and post exposure prophylaxis. That is, you give the vaccine to prevent the attack, or if you have been exposed to a person with Mpox, within 3 days, if you give the vaccine, just like you would do a rabies vaccine, it will prevent the severity or the possibility of getting a Mpox infection. So these have got an emergency authorization after the outbreak in 2022. So they are not very ideal, but currently recommended to people who have a high risk of developing complications, like people whose immune system may be weakened, or men who have sex with men who have a higher possibility of getting this infection, especially in areas where this disease is currently circulating.
Let's circle back to India now, Doctor. We talked about the fact that this virus has crossed national borders. A few cases have been detected in Pakistan and Thailand as well, both fairly close to home. What are the chances of it coming into India, and what are the preparations that we need to be having in place?
It is inevitable that it will come to India. Now the world has no borders. Travel is so common that getting a person infected in Africa and landing within a day in Japan or Alaska can transmit the virus to these countries also. And it is possible that when they land in these countries, they may not have any symptoms but develop symptoms later. So with regard to how we are going to tackle this, the number one important issue is the awareness about this condition, which means all the countries should be aware that there is a condition called Mpox, starting from Africa, can spread to any country with symptoms, as I had said earlier, a viral illness with blisters, which may resemble chickenpox or herpes infections. So people should be aware that this can happen. They should also be aware this is spread through close contact and typically sexual contact, which is how it spread during the 2022 outbreak. So the awareness is number one. Number two is a response to any kind of an outbreak like this, like we did for SARS. The infrastructure has to be strengthened. The public health machinery in typically India has to be strengthened, which the government has already done. They have identified, they have come out with advisories on when do you think of this, what are the symptoms, how do you handle them. The treatment predominantly looks at isolating the patient first, like we used to do for COVID, ensuring that the healthcare worker who's involved in the treatment is also takes precautions using the personal protective equipment, give mainly symptomatic treatment, identify complications which may require antibiotics or other interventions, and most importantly, coming up with diagnostic facilities to confirm this problem. So the Government of India has already identified about 32 labs all over India in various states where you can send a sample from the blister to look for a PCR test identifying the virus. There have also been 3 or 4 places identified, I think mainly in Delhi, where these people can be quarantined, with the support given. But suppose I have a patient in Chennai and I don't have ability to shift the patient to Delhi just for holding them in quarantine, I should be able to identify, diagnose, and keep them isolated with all the necessary precautions. All this is available. As of now, we still don't have a vaccine or specific treatment available commercially or otherwise through government sources to use these brincidofovir, cidofovir, tecovirimat, and vaccines are also not yet available. But I hope we won't come to a stage where we require all that, because unlike COVID, which spread very fast, one person with COVID could infect 3 people, whereas the RO, or the attack rate as we call it, is 10% and the RO is only 0.8 with respect to Mpox. So one person can infect only 0.8 persons. If you look at it, the chances of causing an outbreak is very, very low with Mpox. So usually these kind of outbreaks are again self-limited and die off very soon. And that's what I hope will happen. So we should be aware, we should be prepared, we should expect and have a system in place to handle it. But we just hope that this will pass off quickly.
Thank you so much for speaking to us today, Doctor.
Thank you.
In Focus will be back soon with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.